I would advise medical oncologists and urologists to think really strongly about getting genomic and genetic sequencing data for their patients as they're approaching a time when they might think about using PARP inhibitors. For most community oncologists, this is going to be after they've used FDA-approved agents for metastatic castration-resistant prostate cancer, so after things like enzalutamide or abiraterone, and usually after chemotherapy if a patient's eligible, as well as our other therapies, our immunotherapies and our radiopharmaceutical options. And if you can get the genomic and genetic sequencing data at that point, you might be able to get off-label one of the PARP inhibitors. We've had some good luck clinically doing that. Or you might be able to advise your patients to go to a clinical trial at an academic center or at your own center, depending on how big your site is, to enroll them in getting more data with PARP inhibitors. One of the challenges that we're seeing for men with prostate cancer is that we have so much excitement and so many trials available for prostate cancer and PARP inhibitors that there's a concern that we may have too many trials and not enough patients. So I would strongly encourage and enthusiastically encourage urologists and medical oncologists with any interest in this to identify their patients, and then if they can, for those patients who are able, get them to clinical trials so that they can really help build the data so that we can move this field forward.